Hello everyone, welcome to our channel today. Today we're going to talk one phenomenon in our daily practice. When you come to see a Chinese medicine doctor, funny enough, especially for the locals who haven't seen Chinese medicine doctor before, they will be confused because the patient comes to me for flu or for coughing or even for diarrhea, for digestive system problem. Or even some patients, they come to me for pain, for lower back pains, for shoulder pains. During our consultation, I will ask, how about your diet? How about your stool? Do you go to the toilet regularly? How about your sleeping? I will also, for ladies, sometimes I will ask, how about your menstruation? Do you suffer from painful menstruation? Is there any clot in the blood, the pure blood, or for some other condition? And after all this, I will ask them to show me your tongue. To see from the tongue, I also will feel their pulse. So sometimes people will confuse. I came for the shoulder problem. I came for the flu. That is related all this stuff. So like menstruation, your sleeping, your diet, are these connected or are they related to each other? Why the Chinese medicine doctor will ask all these funny stuff? The fact is they are related. That's why we want to gather as much information as we can to conclude to a cause, actual cause for your problem. So it's very similar to Clivia. This Clivia, you can see a lot of leaves. There are 12 or 14 leaves, like one, the other one, two, three. So they got all these leaves. But when we trace from the leaves all the way to the bottom, it only got one stem, one root. So that's why we gather all the information from during our daily practice. We try to gather all these symptoms. We want to try to conclude to the roots. What's the cause? Because same as this flower, these leaves might be. For instance, if this Clivia is not healthy, if the leaves become yellow, if these leaves become the color change to yellow, then I knew that these leaves have problem. This leaves is not healthy. Then we will fix leaves. But if this Clivia, all leaves become yellow, then I will know that's not the leaves have problem. It's something at the bottom root. The roots have problem. Same as our body. Why we want to find as much information as we can is because, like for this one, if coughing, if the patient have flu, they cough, we want to trace back to the root. But sometimes if I use this leaves only, it won't go to this root because it can go to anywhere. But for instance, they have flu here, they have painful menstruation, they have digestive system problem. They sometimes have very poor immune system and they suffer from flu easily or they caught cold easily. So you can see the more information we gathered, when we goes down the cause, it goes together. The cause, the range of the cause goes smaller and smaller, and eventually it goes to one root. That's why in Chinese medicine we say we are treating the roots. We are treating the root to help to prevent the disease. That's why if you are healed with herbal medicine or acupuncture, you are healed for long term. in most conditions. It's very similar to Clivia. If we fix the roots, if the root is healthy, the whole plant going to be flower, going to be live healthy for long term. If the leaf is shrink, I spray on the leaves only, it can last for a while but not too long. I might need to spray it twice a day, or even I spray twice a day, the second day the leaf still become shrink. That's because we didn't fix the roots, the cores underneath the ground. So from our daily practice, from your tongue, we can see your digestive system, we can see your whole circulation, because for different conditions, the tongue's color or the coating on top of the tongue may change. There's one case we saw in April this year. There's 81 years old white male. He got the chronic heart failure disease. So when he came to me, he was with oxygen tube all 24/7, and he got except the breathing problem, he also told me that his tongue, on top of his tongue, he got a very thick coating, and he hated the coating, so he brushed off the tongue. He brushed the coating 3 times a day. He used the mouthwash 3 times a day and rinse 3 times a day, but the coating is still there. Though I explained to him that the coating is not something on top of your tongue, or it's not something that you can brush off. Why you have this kind of coating, we need to figure out what's behind the coating. So I suggest him, let's use the herbal medicine, let's try to use herbal medicine. It won't take long. I asked him to try for 1 week. So he agreed. He had never used the herbal medicine before, but he agreed to try. Then I prescribed 1 week herbal medicine for him. The second week when he comes, you can see the comparison of the picture. The second week from the tongue is much lighter, and we continue to for another week. So after 2 weeks herbal medicine treatment, the coating was much thinner than before. And when I taught him, I said, the day when you come to see me, don't brush your tongue. I want to see your coating before you brush them. So that's the picture. Before he brushed them, the tongue is clean. So from the tongue, from the different color, like pale, red, pink, or the coating, the color of the coating, the thickness of the coating, all can indicate different condition of our body. That's why in our daily practice, the Chinese medicine doctor will need to check your tongue, need to see your tongue, check your pulse, because also from the pulse we can see a lot of information for our internal organs. Thank you for watching our video today. For more information, you can visit our website. See you next time.